Today I'm going to be talking about the cons of the nursing profession. One of the first things I want to point out is just the hazards and how constantly the nurses are moving around. Just as busy as a doctor would be and how big their role is in the hospital, nurses have a big part in the hospital as well. And nurses are constantly dealing with sharp objects and having to make the patients happy. So whenever something is spilled, say like a carton of utensils that people need, picking them up is not in their time spare. Like they don't have much time to pick it up, so slipping or hurting somebody else can be in the factor of that. And making the patient happy goes along with, say a patient needs to move to another room, your nurse is responsible for grabbing all their equipment, moving it over, putting their own physical health in caution of getting hurt. And say the patient is a heavier kind of person, they're putting their own physical back into helping them move, along with their own physical health. As say the patient is already sick, they can catch that illness and have a chance of being out of work, which means making no money at all and not providing for their own families because they put their job first. Second, I want to talk about the hazards of nurses constantly having to deal with the emotions of patients. Patients can obtain many different emotions: anger, happiness, sadness, or just confusion. They can question the nurse on multiple different things, and the nurse can either have the answers or not have the answers, and they most of the time don't know what to tell them. Patients can be very angry most of the time, and dealing with the patient's anger is a big deal. And nurses can get threats, they can be scared, it's a big deal. And many nurses can feel very disrespected by fellow physicians in the hospitals, like doctors, yes, surgeons, yes, they have a very big role, but nurses contribute to the role. If you didn't have a nurse, then you wouldn't be able to do things around a hospital. The second thing I want to talk about is the hazards of creating a relationship with the patient. Just creating a relationship can harm yourself. And say the patient is going through a really hard time, they're struggling, they have cancer, like just something that's hard, and the patient ends up passing away. Hurting yourself with that kind of a relationship can be very dangerous. You can think about that patient, you could blame yourself for that patient, having to explain to the parents about what happened in the surgery or anything, like making a promise to a patient, like I promise you're gonna be okay, you're gonna make it through this operation, and then not end up making the operation. It's just a big weight on your own shoulders. Another thing I want to talk about is how the nurses don't get very many hours. But if they do end up getting hours, it's like mandatory overtime. They're not given the hours they want, and most of the time if they are given hours, they're given extra hours. Like say they have to get home to their family, they have to go pick up their daughter. Like they don't have much time to go do their own personal needs. And that's pretty much it. That's all I really want to talk about. Yeah, there's many cons of nursing.